I'm going to be working with or speaking with 3 colleagues, and they're going to be discussing mid-career challenges. And so all of our colleagues have transitioned into different careers. And so my part is going to discuss challenges that we all face probably in the mid-career. And so looking at stress in the workplace, the difference between stress and what is career burnout. And so we know burnout often there's 3 factors to burnout. We think about emotional exhaustion. So we have cognitive fatigue and physical fatigue, and then we think about depersonalization, where we become very cynical with our job. And then over time, then we see decreased efficacy in our ability to perform. And so I'm going to talk a little bit about burnout and then give some strategies on how people can become maybe a little bit more resilient in the workplace and provide some suggestions if you are really burnout, maybe you need to consider a different career. I think burnout is becoming very popular, and we hear this a lot probably within the last couple of years. And so the National Academy of Medicine is addressing clinician burnout in our healthcare providers. When we look at pharmacists, very specifically, we see an increased incidence of suicide in pharmacists, as well as increased use of substance abuse. And it is thought that probably burnout is a contributing factor to both the substance abuse as well as the suicide rate. So it's very important that we address burnout and maybe some early warning signs so that we can rectify and maybe stop the burnout. And so, if we do not treat burnout appropriately, then we think about severe depression, we think about anxiety as well. Well, the American Pharmacists Association actually has a website or webpage that discusses pharmacist burnout and gives some recommendations, obviously speaking with the provider and discussing what is going on. They recommend discussing burnout with your supervisor. And maybe the supervisor is unaware of the increased demands and the increased workload. I think when you look at resiliency, we talk about gratitude. Gratitude has a lot of literature that suggests that if you express gratitude to one another, that you become very happy. And so that positive gratitude can overcome some burnout. I think mindfulness in the workplace, meditation, can be very helpful, such as journaling. For me personally, I think it's important to have a personal mission statement, and so knowing this is my goal, or this is why my purpose here in life, and then knowing what values are really important, so your personal creed. And then if you look at those and you live by those, I think it's easy to see, am I in the right job, or do I need to consider a change, or do I need to consider maybe a change in career? I think the key takeaway is live your life with intention. And so figure out what your purpose here is in this world and find a job that fits that purpose. And so maybe you're in the right career right now, or maybe you might need a career transition. But if you live your life with intention, you're going to be very happy in life.